All right, Keisha. So the reason why we're doing this video today, my name's Dr. Tam. This is Lakeisha here, and we want to share something with you that a lot of patients apparently has been asking her, not necessarily me. She gets all the questions. I get a little bit here, a little bit there. So tell me, what have some of the patients been asking about our new Styku 3D body scan? What are chiropractic patients asking? What are ultra slim and metabolic weight loss patients asking?
Well, the first question I get is why did we incorporate this into our office? So they want to know what is it? What does it do? Why
Right.
did we bring it here? What are the benefits in our office for bringing it to our office?
Right.
Mm-hmm.
So initially, I got to tell you guys this. When I first purchased this system, I didn't even tell anyone in the office that we're getting this. I just told them there's a surprise coming. We're putting a room together. You guys will see what it is next week, right? And then the boxes start showing up, and they still didn't know what it was until I actually put it together. But the reason why I did this is because Ultra Slim's protocol is you lose a minimum of 2 inches on the first scan, right?
Yes.
And when we were doing it with tape measure, and then to be quite honest, some people were saying, "Oh, I measured it differently," or they'll say, "Oh, is it a little tighter? It's not tight enough," right?
Yes.
Don't you get a lot of people to say that?
It's too tight. Well, you did it tighter this time and looser this time.
Right. They think
Yes.
that we're trying to lie to them or something.
Yes.
And but I get it because there are scans and system out there that are not FDA approved. I mean,
Yes.
Ultra Slim is the only red light that is FDA approved for fat removal.
Yes.
There's a lot of copycats out there.
Exactly.
And we paid quite a bit of money to get this machine into our office to be able to serve our patients that way.
Yes.
And we
did.
want to be able to validate it.
Exactly.
So initially, that was the reason, was because people were saying, were the measuring valid?
Yes.
So I do my research, and when I do my research, you guys know who are patients already. I'm really gung ho. I'm just all in, right? So I looked at DEXA scans. And these DEXA machines are hundreds of thousands of dollars.
Yes.
And hospitals have them. Not even every hospital has them. Only like the high-end hospitals have them.
Mm-hmm.
And they use technology behind it is they measure the fat density using X-rays.
Yes.
Well, then there is the ones where you hold on to those Omni,
Yes.
hold on. They test the electrodes.
Yes.
Those are like $20, and then there's the ones that you stand on, right? That the Ironman uses, and those are not very accurate. They're not precise. I even bought one. I bought one of the scales. We have it somewhere in the office, and I actually tested out myself. I would hop on and off multiple times, and the precision is not there. So it can only measure body fat percentage. It
Yes.
doesn't actually do the measurements.
Mm-hmm.
So the Styku 3D scan really was initially developed so that people would see what their performance is.
Okay.
But in our office, we're able to measure everything.
Yes.
From the screen that you guys are seeing right now, we're able to measure from the neck. We got measurements of the arms. We got measurements of the chest, the waist, your lower body, abdomen, to your hips. We're able to pivot the scan, and you can see a before and after measurement.
Yes.
When someone does the scan before and after, we had a gentleman last time, and he did after the first treatment, he did one treatment. We did a before and after scan, and he lost 5 inches in his torso. Okay, and
Yes.
he couldn't believe it. He couldn't
No.
believe that overall he lost 5 inches.
Yes.
After one scan. So I want to show some of our patients right now, our clients, what a before and after looks like, right?
Okay.
So in the video on the screen here.
Well, first, what
Okay.
are the benefits of this? Because that's what I get from. Right now, we have a sign in the front,
Right.
and in that sign, we are asking patients to ask about the Styku, and what's important for me and a good thing for me to know too is what are the benefits of this Styku scan besides health. I tell them it gives you your measurements, it also gives you health risk factors, but I want to be able to give the patients more as to why do I want to get scanned.
Okay. No, that's a great question.
Yeah.
So for example, the gold standard now for the last few years for heart risk has been your waist to hip ratio.
Right.
Right?
Yeah.
So for all of our chiropractic patients, or chiropractic clients, or weight loss clients, when you look at the waist to hip ratio, that tells you how at risk you are for heart problems, how at risk you are for cancer,
Yes.
for respiratory factors, you know, and all other inflammatory diseases.
Okay.
So what you want to know is you want to see what your progress is. Now, even if you're not on a weight loss program, if you're under chiropractic care, you want to know what your muscle definition has been. Has it been declining over the years?
Okay.
See, all of our chiropractic clients, you get a one free scan every single year.
Yes.
And the reason why we do that is because you're able to track your health in terms of body fat percentage, in terms of hip to waist ratio. Are you losing muscle? Are you gaining muscle? Are you losing fat, or are you gaining fat year after year?
Okay.
So on top of our chiropractic scan and x-rays that we do, the exams that we do, and how you're doing, we incorporate this to really give you an overall health of what your body is actually looking like.
Okay.
You know,
all right.
Does that help?
That does help, so that even if they're not on a weight loss program, you should still see if your health is maintaining, improving, or declining.
Absolutely.
Okay.
Absolutely, because body fat percentage, you know, and also hip to waist ratio is huge. You know, the more fat your body accumulates, the worse health your body is across the board.
Right.
From heart disease to diabetes to cancer to liver failure to kidney failure, respiratory problems, they show signs. As you gain weight or as you have more body fat in your body, you know, you're going to have an increase of those problems.
Yes.
You know, and you got to go by body fat because the scale can only tell you so much.
Right.
It's like if you have a 200-pound guy in here who is a bodybuilder, right? He's going to have very minimal body fat, like under 10%.
Yes.
You get another guy in here who's 200 pounds, sedentary, right? He could be in the 30s and 40s body fat, and their health risk is completely different based on the body fat, based on the hip to waist ratio.
Okay.
You know, because the guy who's bodybuilding will have a slim waist, right? And a bigger hips because he got muscle in there.
Yes.
Whereas the guy who's sedentary will have a huge waist and a smaller hip.
Yes.
So now that's a health risk factor. And now, you know, studies are showing that's one of the gold standards for heart disease is the hip to waist ratio.
Okay.
All right?
Makes sense.
Yeah. So what does the Styku, what can that even tell you? You know, the Styku scan overall, when you're looking at this, we're seeing the before scans. We're seeing an after scan. So this one was done in 9/26/2018. We just did one for this young lady today. And when you're able to spin, you know, it's 3D, so we're able to spin, and you can tell that her stomach and waist area was a lot bigger here than it is here. And it's able to track the measurements. And trends is really cool, right?
Yeah.
This patient's been working out, okay? So we can see overall, when we're looking at trends, if we're gonna turn her one way and spin the body this way, you can tell that in her waist, right? The narrowest part of her waist, when you're looking at the side measurements, you see it went from, going back up here, 37.58 to 37.3, and whoa, it dropped all the way to 36.68.
Yes.
And that's exactly where you want to lose fat, is in the top, the abdominal area, right? Because that's where the liver mainly sits. Then you got the waist abdomen, right? But if you look at the side view of her, she's got a little bit more, or she lost quite a bit here, but it didn't go down as much in this part of the waist. But that's because she's been building a lot of muscle.
Yes.
Because look at her buttocks right here, right? Before and after. She actually gained, right? Because she's been building lower body abdomen muscles. She's been overall gaining it.
Yeah.
Gaining some inches. She's been building her butt muscles because it went down. She lost the fat, and look at it going up. She's been working out. She's been literally working her butt off.
Yes.
Or working her butt on, if you can call it that way, right? And now you can look at her legs, because her legs also you can see.
Right.
Her legs, initially she lost a little bit, but because she's been working out, she's been building massive amounts of muscle in her legs, even in her calves. You know, she's been, you know, doing her due diligence, working out.
Yeah.
The other cool part is when we look at the cross-sectional area, you're able to see back and forth, like if I do a zoom in one area, we're able to see what her actual, look at this, right? Her calf was like, before and now. We're able to see if you were to do her abdominals, we're able to see the narrowest part of the abdominal, okay, compared to where we were. Well, it's not showing right now. This is the green, and it should show the red in here. Let's try to pull that scan right there. Let me make sure. But you can see it overall what it is, and you can see the trends, right? And you can really tell what the body is actually doing. If we go back to the silhouette and the profile view, and you get the silhouette view, we're able to see quite a bit of difference. Oh, this is the silhouette over here. Profile. For some reason, it's only showing one, but we'll go back to the body measurements and go back to the one screen view to show what it is. So here's the 3D one. Let's go back to the 2 view. And you can see that it's pulling this up, and it's pulling up, the before and afters. But the trends is where it's at, and we're able to show patients before and afters. Okay, and we're able to track them. The cool thing is we're able to track them from the day they start to, like, say 6 months later. We're able to see, hey, where are you at 3 months later? We're able to see where you're at 3 months later. If you're looking at, just decreasing the amount of waist, narrowing abdominals, or you're building muscle. Say if this person goes from losing weight and she's like, hey, I want to build up my butt muscles here.
Right.
Has it been building up?
Right.
It has. It's been building up this whole time, and that's really her ultimate goal. So this scan is going to really revolutionize I think it's going to revolutionize the way we do weight loss in our office.
Absolutely.
Because we've always talked about how losing weight, it's not just about losing weight, cutting calories and just working out.
Correct.
It's about improving your health.
Exactly.
Increasing your energy, improving your health. And part of improving your health is your waist to hip ratio.
Yes.
Is part of your overall body fat percentage.
Exactly.
And it's so cool because this actually shows the measurements when we do the before and afters, right? It'll actually show you what you've lost, the amount of inches that you've lost in the torso, neck, and she gained a little bit in the legs because she's been working out, right? So it shows you all this here throughout, and that's why I think our patients have really enjoyed it. Every single patient that we've had in here have really enjoyed what we did.
They really, really do. The playing around with it just with patients, with me, your favorite part is the trends. My favorite part is the health. Because again, with you talking about the health itself, you can also go to risk reduction calculator, and this will let you know what you can reduce.
Like this is where they are right now.
This is where they are right now. So if she loses about 6-7 inches, that's where it was at. Oh, see, even less than that, about 3 inches, it will take her into moderate risk.
Right.
So it will tell you what you need to lose to get you into normal levels. You know?
Right. So that could be their new goal. It's like, I want to get healthy.
Absolutely.
Let's get you down, 4, 5, 6, 7 inches, and you're into a new health range. Normal risk level versus right now where she's at high risk. So this is definitely, I mean, it's going to be a game changer overall.
Yes.
And I'll tell you, we're the only ones doing this. There's no one is doing this except for us, and I'm really, really excited about it and really introduced. If you're a chiropractic patient already, I urge you to get scanned so you can see what your health risk assessment is. You can at least track, if anything, if you're not trying to lose weight, and not everyone's trying to lose weight or build muscle, but at least see where you're at, okay? And then a year later, you can see once again where you're at. The patients who've taken advantage of this love it because we send you an email of pretty much all your numbers. You get an email of everything. And then we don't charge for this report, but you get scanned every year. And for our chiropractic patients, there's no charge. For our weight loss patients, over the 6 months the first 6 months that you're with us, you get equivalent of 6 scans.
6 scans.
And it's been amazing. They love it. We love it because it's like, hey, this is our program works. How many pounds is she overall with the body fat and everything, it wasn't so much the weight, it was the fact that she gained all the muscle.
It's the fact that she gained all the muscle. So it's in this particular patient, she really wasn't worried about the weight reduction.
Yeah, because she was building muscle the
Because she
whole
was building
time.
muscle the whole time.
Right. What was that
Exactly.
one gentleman that came in? He worked out a lot,
Yes.
right? He got his scans before and after. He couldn't believe it, but what was it, 3.5 to 4 weeks?
4 weeks.
4 weeks.
Yep.
What did he lose? What did he lose in 4 weeks? He lost a lot of weight.
It was in 4 weeks he lost 19 pounds.
19 pounds?
Now 19 pounds
Okay.
in 4 weeks. But the wow factor to that is that he was stuck at a plateau for a very long time because
Wasn't it 29 or 39?
29.
29.
Excuse me.
Yeah.
See?
29.
29. 29. That's right. 29
Yeah.
in the 4 weeks. The amazing thing about it was that just the week before I weighed him, and he was still at just, I want to say actually around maybe 12 pounds lost.
Okay.
Just the week before, and he was just stuck at a plateau for a little bit.
Right.
We tried all of our techniques, and then he was letting me know I work out 5 days a week, and I go, as he would say, hard in the gym. And I go, whoa, wait, are you allowing yourself to rest? And he's like, no, I don't do that. So he finally took my advice because it was just, I'm at a loss. And
Right.
I even talked to you about this, and you told me he's got to rest, Keisha. Get him to do it. So I finally was able to get him to do it. The next week he came in, total loss was 29 pounds at the end of his 4th week.
Wow. So you guys see it right there. I mean, first couple of weeks, he lost 12 pounds, Week and a half, 2 weeks later, when he came back to get checked, he lost a total of 29 pounds.
Yes.
Who is excited about losing 29 pounds in 4 weeks?
Right.
If you're trying to lose weight and if you're frustrated at your weight loss program, if you've tried everything else and it hasn't worked, it's time to try something new. It's time to try something better. We measure, we track you, and our whole program works. So if you have any questions, don't hesitate to give us a call. Our phone number is below, and we'll see you next time. Have a great day.
Also, the scan only takes about 3 minutes to scan you all the way around, and so it doesn't take very long.
Yeah, that's like with getting dressed and everything.
Yes.
Because they're only on the platform, I think 45 seconds.
45
but
seconds.
we give you a couple minutes to get dressed. So.
Yeah, so I'd say 3 minutes. 3 minutes to get life-changing answers for you.
All right.
It's worth it.
Perfect. Thanks, Keisha. Thank you so much.